with without anything to hide, and telling the people the tricks and the experience that we have for more than 15 years doing the same. And I was very, very grateful for the invitation and for the way people treat me. So I'm really happy to be with you today and whenever you want.
So this topic, treatment with aligners, I think that it's a very interesting topic, and I have a lot of colleagues in Bulgaria that always send me the message, Nadia, please do more courses about this topic, because a lot of patients go to the orthodontics clinic and told to the doctor, please doctor, I want it Invisalign, I want aligners. So
Yes.
I think that nowadays we treat many patients with aligners. And can you tell us about your practice, how you manage your orthodontics practice? You have a very successful clinic in Madrid, and I know that you are working 99% of your cases with aligners.
Yeah, yes, indeed. Well, it's a game-changing technology. I mean, you have to understand how it works. There's no limitations nowadays because we can use the aligners in combination to cortical anchorage with temporary anchorage devices. So we can achieve any movement, and we can fight for the excellence in complex cases. The only thing is that you have to try a lot of things in order to get the understanding of the limitation of the aligners and how can you manage those limitations in order to get excellent outcomes. So experience is the key, but you have to get some knowledge about the working of the plastics and the biomechanics, which is very different to biomechanics with braces. It's very different the way they work, as I'm going to explain in a few minutes. So you need to understand each other with the CAD designer. You have to communicate well with the right words in order to get the outcomes in a short period of time. And once you get this information and you get this experience, you can change completely your practice because most of the work's on your computer. And with the patients, it's a very short period of time with the patient because 10 minutes is enough to get an appointment done. So that's the way I understand orthodontics nowadays in my clinic.
Because we can treat more and more patients, yes?
Yes, I can treat more patients. I have an interdisciplinary dental office, so I need to be quick. I need to be effective, but because I have another specialties waiting for my results, so I need to be very quick in the treatment. So 1 year, 1.5 years is my time of orthodontic treatment, even if it's a complex treatment. So I can treat patients from every ages without any problem with aligners.
And we know that the biomechanics with fixed appliance and the biomechanics with aligners is different. Can you tell maybe 3 main differences between the fixed appliance and aligners?
The fixed appliance works very well, actually, but it's completely different the way they work. I mean, fixed appliance work by pulling the teeth. So the aligners works the opposite, pushing the teeth. So once you understand this big difference, you can understand the way to manage all the cases, all the movement that you plan in the software. So that's the main difference. It's more comfortable for the patients. You have a very short appointment. 10 minutes is enough to a good orthodontic appointment with alignment. With braces, we all know that it's completely different. You have to spend more time bending wires or relocating braces. So it's more difficult in the daily basis appointment. Okay, so once you understand the biomechanics, you can plan a treatment. You only spend 1 minute maybe in a reviewing of a treatment in the software, and then you can go to another one, and that's it. It's very quick. I spend 1.5 hours every day checking not only my clinchecks or my orthos, 3D orthos, but also checking the clinchecks and the treatment of other doctors around the world. So
maybe now we can talk. We can say about our new proposal to our colleagues in Bulgaria about your help Dental Academy and Dr. Victor Gherero. Do you want to talk about this?
Yes, well, we have this offer. We call it a TPS, Treatment Planning Service. It's a way to treat cases, even complex cases, with my help. Okay. Actually, we establish a communication between the doctor and me through the software, even Invisalign or angel aligners. I understand that you have it nowadays, angel aligners, or it's something brand new in Bulgaria. So you're gonna have access to angel aligners as well, Spark or whatever company, because it's the same. I mean, the mechanics is the same with every company. So I can give you the assistance and the guidance to the doctors in order to plan the treatment in a very short period of time and approve it with confidence that it is going to be a predictable treatment with few problems. And we can get a companion to the doctor in order to correct the possible problems that you have in between the planning and the execution of the treatment. So that's a service that we are offering for many years to doctors around the world. Language is not a barrier because everything is in English, but nowadays we have artificial intelligence that can translate in a short period of time, even if you write the specification to the CAD designer in Bulgarian or in Portuguese or in whatever language you want.
Yes, so you did this type of service for a lot of years, yes. And
Yes.
it's like, imagine that I do orthodontics in my practice, but I worked a lot of braces, and I have a patients that they want treatment with aligners, but if I don't have knowledge and practice, so I can call to Victor and and say, Victor, please help me with this case from the beginning until the end. So you can help of everyone, every cases. Yes. Okay.
Actually, I can manage the planning of the treatment. I write to or text to the CAD designer in order to get the perfect staging of the movements and the final result. But it's not only that. I can communicate the doctor exactly what to do in every step of the treatment. I mean, you have to use, for example, these elastics from this tooth to this other, and then you have to change it every 7 days, the liners, and then you have to add maybe a tat in an zygomatic crest in this stage specifically. So the doctor is going to have the whole information about the treatment during the treatment, and if any doubt can be resolved by me, I can do it whatever the doctor wants.
Yeah,
So
this is great news. This is great news because I have a lot of colleagues always send me cases and ask for the help. So I decided to do this type of service. So, and what about predictability? Because for me, this is the most important. How we can obtain more predictability with our
Okay, motivation to the patient in order to get compliance of the patient is very, very important. The wear of the liners is the key to success in this kind of orthodontics. But the staging, the selection of attachments, the diagnosis is very important. Sometimes I discuss with the doctor, for example, if I want to treat a class 2, maybe the doctor wants to distalize, for example, molars, and maybe the class 2 is not for a maxillary problem. Maybe the problem is in the mandible, and we need to use a mandibular advancement device. So I discussed with the doctor, and we can change the treatment plan according to the changing of the diagnosis, and that way the predictability increase. I mean, the right diagnostic, the right selection of attachments, and the right staging of the treatment, and the motivation of the patient is very, very important. Okay? The using of aligners is mandatory to get a success in this kind of treatment.
Some tips in your practice to how we can optimize our treatment.
Yes, you have to have a protocol. Protocol is very important. Okay, protocols of appointments, protocols in the bonding of attachments, protocols in the placing of mini screws. You have to have a protocol, and you have to be very fast. You don't have to waste time looking for things. You have to be very organized. That's my first and more important advice. You have to have your team prepare for this kind of patients in order to be more efficient with the time. Okay, and you have to know what to do in order to solve problems during the treatment. For example, if the liners is not fitting very well, you can solve the problem without a new refinement, only by making some things with your hands. I mean, for example, buttoning a bottom and using an elastic. So I can give you that information as well in order to solve the problems in situ, in the same time, and that way you can be more efficient during the treatment, and the patient only have to go maybe every 3 months, so you can get more patients and you can get more efficient in terms of time, in terms of money, and in terms of protocols in your clinic.
Victor, can you tell us about your first appointment? What you normally do with the patient?
Yeah, well, in our first appointment, we are very focused on the experience of the patient. The experience of the patient has to start in the first appointment. We show the patient a 3D realistic mock-up of the final outcome of the treatment in order to motivate the patient to accept the treatment plan. The treatment plan is not only orthodontics, is maybe restorations, maybe implants, or maybe another specialties of dentistry. But the motivation is very important because the patient feels very well, very happy in the first appointment, looking the final result in real life with a mock-up. So you need a very good lab to do it. You need a very fast protocol in order to not to make the patient wait for 2 hours to get this result. So this is very important. So your team is the key to succeed in this kind of procedures. So you explain the patient with all the records that you have, the digital records. We take CBCT, we take intraoral scanner, and a set of photography pictures in order to show the patient the diagnosis and the final result. And Then we start the treatment in 3 to 4 weeks after that first appointment, in order to get the patient involved in the treatment, and not to maybe wait 2 months to start, so the motivation is going to decrease. And so for us, this is the most important thing, to get the patient motivated. So the first appointment is very important. The duration of the first appointment is 1.5 hours. We have time to do all the things. So your team is going to be prepared to receive the patient in the first appointment. So that's something that need maybe training and need time to understand. But once you get it, you're going to have very successful treatments.
What about the attachments? Which type of attachment?
The attachment is the key. Okay, the attachment is something very important to understand, because remember that we need anchorage in orthodontics. We need anchorage. Remember, we don't have a wire, so we need good attachments, big ones. Okay, conventional attachment. I don't like the optimized attachments, because they are too small for the retention of the liner. So you have misfitting of the liners very, very fast. So I prefer the conventional attachment, and I like to design the attachment as well. I modify not only the shape, but also the exact position in the ground, in order to get more efficiency of that anchorage. So attachment is one of the most important things in this kind of orthodontics.
What about the stripping?
Stripping. Okay, you have to take into account the Bolton analysis. The Bolton analysis is mandatory in our profession, and you have to select exactly the area where you are supposed to do the IPR, the interproximal reduction, the stripping. And I have my tricks. I have my tricks to do it fast, to do it easy, and without being too invasive. So I have my own protocols in order to avoid too much stripping in the patient. So I can explain to the doctors through the TPS, through dental academy, and through you. I can explain the patient everything, the doctor everything that I know during the treatment.
So, and you have protocols, for example, class 1, class 2, class 3, complex cases. I know that you work a lot with this type of protocols. About
Yes.
your preferences.
Yes, I have clinical preferences, and I have protocols for every malocclusion. Even if a skeletal malocclusion, you want to compensate, or you want to perform an orthodontic surgery, we can do it with our protocols. And we know that our protocols work because we have several years in this, trying. And sometimes we make mistakes, but we learn about those mistakes, and we improve the protocols day after day. Remember that this is something that is growing and is developing as we speak. So we have to innovate the protocols, but we have protocols that work in a daily basis practice. So that's the protocols that are applied in my cases, and in the cases of the doctors, through TPS, through dental academy. So even I have the recipe, I have the text that I have to send to the CAD designer, so we can understand each other. We can approve a case maybe in 1 week or 2 top. Okay.
And what about the treatment of children with liners?
Okay, nowadays I have better results, and in a short period of time, 1 year, 1.5 years, even in the most complex cases. So in my opinion, if you control everything about the plastics in the software, and you have a knowledge of the perfect staging for each malocclusion, you can have a better result with the liners. in comparison to braces. With braces, sometimes because the friction, because maybe the long appointments, you can have 2.5 year treatments on a regular basis. With aligners, we can do it faster and with the same results of occlusion, of stability of the case. So in my opinion, if you control this, you can be more efficient and more effective with the outcomes.
Many colleagues think that they can send the case and the technician will do the rest and do the clean check and do the plan of the treatment. And this is so wrong, Victor.
Sometimes you don't feel confident. I mean, you feel that you don't know too much, so you feel afraid to take decisions, to make decisions. So you need some help in order to be more confident in your decision and the communication with the CAD designer. So that's the service that we offer to the doctors in order to this learning process to be more quick and effective. So you have to start. You have to be prepared. Obviously, you have to diagnose exactly the same, but you need the tools to get confidence about your decisions. So that's the help that we can offer to the doctors. And we are doing it on a regular basis during several years.
Yes, I think that the secret is learn, and practice, and find somebody like a mentor that can help you, and to do the best practice. So this is the picture. These are the picture of our course in September.
Yes, it was very great experience. I was a little afraid about the language, but everything went very, very well. So I'm very happy with the result.
Yeah, we have translate. This course was 2 days practice, mini screw and aligners, biomechanics of aligners. Let me see if you have some questions.
This is our dental office, and this is my team. We have a very specific protocol of pictures in the first appointment in the left side, and this is the pictures, the initial pictures, and during the treatment you have the standard pictures in order to get the records of the patients during the whole treatment until the end. So this is something very important to us. And we use this specific CBCT, low dose CBCT. Is very, very nice for the diagnosis in the first appointment. You can have a perfect view of the bone and the soft tissues, even the position of the roots, the nerves, and the anatomic structures. And we have a very good lab, actually very, very fast lab. So we can get this design in ExoCAD in real time during the first appointment, and they send to us this model here in order to get the mock-up in the patient's mouth. In a few minutes, we have this result, and we show the patient in a video with this music in a dark room in order to get the experience more appealing for the patient and motivate them to accept the treatment plan. This is something that we do in the first appointment. So at the same time you're motivating the patient, you can plan the whole treatment with these digital watts. So the mock-up is very useful for us. So sometimes the patient gets emotional during this video because he is able to, or she's able to see the final result, the final outcome with something that is in her mouth. And that way you get the patient reaction, and you get the patient motivated to start the treatment. Something that we do on a regular basis in our clinic. So we have a very good lab. We have a very good ceramist in order to get these results. As you can see, the way they treat everything with naturalness, and this is very important to us in our results. And I have to be efficient with orthodontics. I have to be effective. I have to be very, very fast in my results. For example, in this case, as you can see, a periodontal case, and you can see the crossbite of the canine, and the way we solve it with in a very short period of time with aligners, only knowing what to move, what to over-treat, and this is the final result in only 7 months. 7 months, okay? So that's what we call efficiency. I mean, 7 months, the patient is happy and is prepared to receive another treatment in periodontal and restorative, etc. So we have to be very efficient in this result, as you can see. 7 months. Or for example, this case is an open mouth, here open anterior problem, and only 11 aligners, 11 weeks. It's amazing. Some extrusion of the lower incisors, some intrusion of the molars, anterior rotation of the mandible, and some short elastics. And over-treat some movements. That's the key of success. And then we can get this result in only 2 months. Only 2 months. Okay, I planned this case for 1 year. In only 2 months, I got this result. It's amazing. With aligners. Okay?
Yes, but it depends of the protocols you use, how you write to the technician. It's not only send the picture and wait to aligners. You need to know what you must to write to the technician.
Exactly. Or more complex cases, just like this one, a class 2 malocclusion with open bite, and we can solve it in 1 year. And even the canting of the occlusal plane without many screws, as you can see, the correction of the huge overjet that this patient has in a few months. Look at the result in a few months. Okay, so the diagnosis is very important, but the way you move the teeth with aligners and the way you over-treat some movements is mandatory to get this result. The understanding the way the aligners work and by pushing the teeth is very important to get a good plan of the staging of the treatment. So the way the pressure point work in the tooth, the way the attachment work as well, it's very important to understand how to bond it, where to bond the attachment in order to get the movement done. You have to perform some IPR during the vertical movements. Otherwise, you're not gonna have the result that you are expecting. So this is daily basis decisions that you have to make during the treatment, during the planning, okay, in all your patients.
Yes, because if we don't have enough space.
Exactly. This is a closed system, so you have to manage the spaces in this mission of the teeth in order to get the movement done. So space here is very important. So you have to check the contact points in every appointment with a floss, so you can reduce a little bit the enamel in those areas where you have a very strong contact points. So the movement that you plan in the software can express without any problem. So you have to understand this. And you have to understand that the way the aligners in the plastic works is just like this, it's pushing. And so if you push the crown, remember that you have to receive a momentum of force, and you have to control it with the right decision of where to put the attachments in order to over-treat the root, the buccal root torque. So this is something that we have to do in all the patients in which we develop the arch. So this is part of our protocols and the things that we apply in every patient, as you can see. The pressure points to intrusion movements are very important as well. The selection of attachment as well, as you can see. The way they work is not only anchorage. Remember that the attachment has a beveled area and a flat area, so the force is going to be applied on the flat area, and you have to understand that to select the correct or the right attachment for each movement, in each position. Okay, as you can see, the power reaches, where to use it, where not to use it. Remember that there are some pressure points with more force, 50 grams approximately, in order to get root control of the torque. So you have to decide exactly where to put it. Otherwise, you're going to have problems with fitting of the liner. So every decision, I know that I'm giving too much information in a few minutes, but the message here is that there are protocols that work very, very well. So you need to learn it, and you need to apply it, and you need to solve the problem during the treatment. And that's the support that we can offer to the doctors through you, Nadia, through your dental academy, and well, we can start whenever you want. The way we use the 3D tools is mandatory to have a good control of every tooth and a good result of occlusion, and know how to where we need to overcorrect some movements in order to get the desired result in the patient's mouth. Okay, that's very important, because sometimes you plan something here in the software, but in the real life doesn't happen. So you need to be prepared to know that in every case. So we have a lot of years doing this, and we have a lot of mistakes making or made. So I think that's the key, the experience, and to learn about the mistakes and to correct and improve the protocols that we apply.
Yes, because here everything is beautiful in the software. Yes.
In fact, in the software you can do whatever you want, but in the real life, sometimes it doesn't happen that way. So you have to know that in order to be successful in this kind of treatment. The materials that I use, I don't hide anything. I can share with the doctors exactly the materials and the bonding, the composite, the pliers, the elastics, the mini screw devices, everything that I use to be successful in orthodontic treatment with the liners and clear aligner therapy. This is my whole orthodontic dental office here in this picture.
Your table. I know that you don't use flow to
Exactly. For example, that's
attachment. Yes, you only
a
use
very
composite.
common mistake. You have to use a very strong composite with a lot of ceramic on it, because transbond is the transbond doesn't have enough ceramic to be resistant. So if you place an attachment with this material, you're going to have a problem of erosion of this attachment. So you have to be prepared to decide which composite is the best in your option. For example, I use the mosaic of Ultradent, which is a very good brand and a very good composite and a very aesthetic composite because it's transparent and you can barely notice, you can barely tell that you have an attachment in a tooth, on a tooth. Spark aligners is a very good system. We can give you the support in this platform as well. And a very strong software with a lot of 3D controls, and we can plan this in this platform as well if you need it. And in yellow liners, which is the brand that I use nowadays. I changed from Invisalign to Angel Aligners 1 year ago, so I have a lot of cases with Angel Aligners. And what I like the most about Angel Aligners is the software, not only the plastics, which is the best in the market, but also the software. As you can see, I can have a cephalometric analysis in 5 seconds with artificial intelligence. And this is for free. I mean, you have the software, and you can do this with every patient, even if it's a braces patient. So you can have a VTO, you can have a superimposition, even you can have the Bachetti analysis in 5 seconds. So you can decide the perfect moment to start maybe a mandibular advancement or orthopedic protocol, as you can see. So the software offers you a lot of things that other software doesn't have. And as you can see here, we have the contact points during the whole treatment. So you can manage the premature contacts. We have this section mode where you can adapt the occlusion perfectly, cuspid and fossa occlusion in every area of the mouth. You can see even the roots and the relationship with the cortical bone. So you can decide exactly the root torque that you need in that specific area. So a lot of things to perform a good plan of the treatment. So that's why I'm very happy with Angel Aligners. And I understand that you have Angel Aligners now in Bulgaria. It's something brand new, a couple of weeks ago, something like that.
Yes, but I don't know the more details about this.
I mean, as you can see, you have the CBCT integrated in the software, so you can check every part of the bone. So the staging is very important to get this result. As you can see, good finishing with the liners. That's something that people say very often, that the liners, you're not able to have this kind of result in the occlusion intercuspidation. And this is far from true. You can do it exactly the same you do it with braces, but with aligners. So remember that you have a lot of auxiliary techniques, buttons, elastics, tabs. So remember, we are orthodontics. We are not Invisalign providers. Okay, so you can mix sometimes the biomechanics in order to get the result in a short period of time. So, for example, this open bite, only with a few movements, we can get this result in 5 months, because we know exactly where to move or where to intrude, for example, the molars, in which amount of intrusion, which is predictable. So we can get this result, as you can see, an asymmetry solved in 5 months, okay, with the liners. And look at the intercuspidation, the anterior contact, the development of the arch, okay? And it's important to have the tools As you can see, we use a lot of these kind of pliers in order to get some modifications of the liners during the treatment, maybe to put a new button that you haven't planned from the beginning. So it's important to get these pliers if you want to do clear aligner therapy on a regular basis in your clinic. So it's very, very important as well. And this kind of auxiliary techniques, as you can see, this is something very common, that you have problems of adaptation in the lateral incisors because of the shape of this teeth. So you can have a static button and elastics and solve the problem in 2 weeks without a refinement, for example. So these kind of tricks are very important, and I can give these tricks to the doctors through the treatment planning services, through Dental Academy, and well, through Nedia.
It's amazing, a big support for our colleagues, yes.
Yeah, the incorporation of stats are very important to perform difficult movement. The way you use the elastics is very important to understand that you don't have a wire, so you can have a triangle elastics because you have a component that you don't decide in this particular mechanic. So you have to decide how to use the elastics. Those tricks are very important. You can see here. And mini screws for difficult movements, midline movements. So it's something that I use very, very often. And I can explain to the doctor where to put it, which brand he needs, and the technique that I use, and several courses that we hope to do with you in Bulgaria to have this interaction with doctors and to share what we do with some patient, as you can see.
It's amazing the way you share your knowledge and practice and experience. Amazing, Victor. Thank you so much.
No, you're welcome, and thank you for this opportunity to share a little bit of what we do, and remember that you count on me whenever you want.
This is amazing case. I already know this case. Amazing, really.
Yeah. For example, this is a maxillary complete intrusion with 7 mini screws and aligners. This is something that 20 years ago was impossible without an orthodontic surgery, and we can do it nowadays on a regular basis. I have a lot of patients with this mechanic. So the clinical guides, it's a technology that is very common nowadays. We can apply these guides in order to be more accurate in these mechanics. For example, in a canting of a piece of plane, as you can see. So everything is possible with aligners in combination to temporary anchorage devices and elastics and buttons, common sense, and good diagnosis.
Yes, exactly. And open mindset.
Think outside the box.
Exactly,
Right.
exactly. I know that you love to use this brand of mini screw, Christian, and we already have in Bulgaria in the market.
Yes.
It's
You doctors can get this excellent mini screws through Nadia.
Yes,
Yes.
excellent brand. Yes,
Mm-hmm.
I use a lot of this mini screw. And
Exactly.
you normally change the aligners every 7 days?
It depends,
It depends on the
the
case.
complexity of the case. In adult patients, I change the liners every 10 days in adult patients. And with more complex cases, every 2 weeks. And with people from 12 years and children, 7 days. 12 years old, 12 years old is adolescent, a teen patient, okay? Every 7 days. But with adult patients, 10 days is my recommendation nowadays. I've tried 7 days. I tried 2 weeks for everybody, and my recommendation, 10 days is enough.
Yes, me too. I use your protocol always.
It works very well.
Great, great. Victor,
If the
let me
doctors
see.
have questions or something.
Колеги, иска ли някой да се включи за въпрос? Ще дам думата сега на колеги, които биха искали да се включат. Ако някой иска да каже нещо, да зададе въпрос, може да го направи сега. So we will send the link for our colleagues, the link with more information about this type of support you can give to us. Any questions? And Victor, we need to discuss our new course in Bulgaria.
Okay, perfect.
And
Perfect.
very soon we can give the date and the topic.
Perfect. Count on me, and thank you very much for everything.
Thank you. Thank you so much. Always you are amazing. I really appreciate, and for me it's a big pleasure to every time I hear you, your knowledge and experience, and I want to thank to say thank you because you always help me with my complicated cases, and it's amazing to know that I have your support and help for everything. So you can give this support to everybody in Bulgaria. Okay,
Thank you. To share what we know. We don't have all the answers, but we have a lot of passion on this, so we can help whatever we can in order to get more successful results and outcomes in clear aligner therapy around the world.
Thank you so much. Колеги, мисля, че нямаме въпроси, поне никой не иска да зададе нещо неясно, което е останало. Ще изпратя линк в чата с тази услуга, която толкова пъти споменахме сега на презентацията. Ако вие сте ортодонт, имате случай с алайнери, които имате затруднения, не знаете как да ги излекувате, имате пациенти, които отиват в вашата практика и казват директно, че искат да се лекуват с алайнери, а вие нямате все още тези знания и опит, винаги може да се допитате до Виктор Герреро, който ще ви насочи и ще ви даде ясен протокол и план как да излекувате тези пациенти. Срещите са в Zoom и за повече въпроси винаги може да се обърнете към екипът на Dental Academy, да пишете на лично и на телефоните, които вече знаете. Очаквайте новите курсове през 2025 с Виктор Герреро, различни курсове на тема алайнери и мини импланти. И искам да благодаря на всички, които отделиха от времето си и се включиха в този вебинар. Наистина се надявам по някакъв начин Виктор да е бил полезен и пожелавам ви хубав и спокоен ден. Да, докторското ще изпратя запис. Много съжалявам, че не сте успели да чуете вебинара. Мисля, че просто сте имали проблеми с вашите лични настройки, защото другите колеги казаха, че се чува добре. Ще изпратя запис. Още веднъж много благодаря на всички и до нови срещи. Thank you so much, Victor. Have a great weekend and see you soon.
See you very soon. Thank you very much.
Thank you. Bye bye.